Omada Oda's life has become a struggle for survival. Daily bombings, the search for food, and relentless violence. And in desperate need of a new kidney, his lifeline is dialysis treatment.
Now I am only treated twice a week, 2 hours each, and this is not sufficient to sustain my kidney. Needless to say, we are starving, cannot find clean water and living in tents. Even the routine medications are no longer available. Besides that, I am diabetic, with high blood pressure too. I cannot get my hands on insulin anymore. Our life is now impossible.
For these dialysis patients in Gaza, the war has turned into a nightmare.
After Al-Shifa and all the other hospitals went out of service, all the kidney patients are now treated here at Al-Aqsa Hospital. This is no longer a dialysis process, it is a life-saving procedure. Simply put, each patient is receiving only half the amount of treatment they need.
Kidney patients need a specific diet, but that's hard to maintain in a war zone. 70-year-old Muhammad Saleh says he is forced to eat whatever he can find, even if it means putting his health at risk.
The treatment we now receive is not sufficient to cleanse our kidneys, and we no longer have our routine medications. Borders are closed and even aid is not reaching us. We are bombarded, starved and under siege. What else left?
And the lack of stable power, fuel for generators and dwindling medical supplies means doctors have to make tough choices.
The Israeli occupation forces destroyed all the dialysis machines at Shifa Hospital on purpose. 60 machines catering to 350 patients, including children. As a result, all the surviving patients are now being treated here at Aqsa Hospital. This is a massive load, especially since electricity is not always available. That is why we were forced to reduce the number of hours, but this has a very negative impact on a patient's health.
For the families of the patients, every day is a test of endurance.
Before the war, we used to reach the hospital with comfort. We used to enjoy peace and security. We used to have the basics, but now we are left with none. We cannot even transport my husband on a donkey cart. I have to push his wheelchair all the way to the hospital on rough terrain, flooded with sewage and under Israeli non-stop bombardment. I myself have a heart condition and a back problem.
For kidney patients in Gaza, war brings more than the threat of violence. It threatens their access to life-sustaining care. Their lives depend not only on the machines, but on the willingness of everyone to see them more than just the product and casualties of war. Hani Mahmoud from Al-Aqsa Hospital in Deir al Balah City, Palestine.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.